An injury to the front of the pelvis, like pubic symphysis dysfunction, can cause pain with walking, getting in and out of bed, and getting in and out of the car. The strategies in this video should reduce pain with these activities. Here's normal walking. You can see normal stride length, not thinking about how I'm placing my feet, walking at a normal pace. Here it is again. You can see space between the knees, normal space between the feet. Walking like this when a person has an injury in the front of the pelvis causes a lot of stretch at the joint, causing pain. To reduce pain, walk like you are wearing a mermaid tail. You can see here the knees are very close together. I'm taking very short steps. This reduces stretch at the joint in the front of the pelvis and reduces pain. Imagine that you are wearing a pencil skirt or that you have gum stuck between your knees. Don't let the gum drop as you walk. Here's an example of getting in and out of bed normally, sitting on the edge of the bed, lifting in the legs, and then lying down flat, reversing this process to get up. When a person has an injury at the front of the pelvis, separating the knees wide like this stretches the joint and causes more pain. Instead, remember your mermaid tail. Walk with short steps, knees together. Sit on the edge of the bed. Keeping your knees together, lift both feet onto the mattress at the same time. Then lower down onto your side using your arms. From here, if you wish to change position, first move your knees, keeping them together, then lift your pelvis into a bridge to land on your back. If you wish to change sides further, again, keep your knees together, turn them toward the mattress, then reposition your pelvis. Place a pillow between knees and ankles to support your legs in neutral and limit rotation at your pelvis. This is a great position for sleeping. A rolled hand towel under the waist helps support the spine. To get up, gently squeeze the pillow between your knees, raise both knees towards the ceiling at the same time, then bridge to lift your pelvis. Again, move your knees, gently squeezing the pillow, then lift your pelvis to turn all the way onto your side. Still gently squeezing the pillow, slide both feet forward until they are off the mattress, then lower to the floor. Push up with your arms until you're sitting on the edge of the bed. Take out the pillow, then slide forward until your feet are on the floor and rise to standing. Use your short steps and close knees as you walk away from the bed. Here's an example of getting in and out of the car normally. Opening the door, stepping into the car, sitting down on the seat, and getting ready to drive. This technique separates the knees wide front to back, side to side, and also requires balancing on one leg. All of this places significant stress on the joint in the front of the pelvis and can increase pain. Instead, remember the mermaid tail. Walk with knees close together and short steps. Come all the way up to the car and sit sideways on the seat facing towards the camera. Then, keeping knees close together, move your legs one at a time to step them into the car, keeping those knees nice and tight. Reposition your pelvis and pivot until facing forward. To get out of the car, reverse the same process, again using the mermaid tail technique. Keeping knees close together, pivot until you are sideways facing out of the car, moving one leg at a time. Then use your arms to pull to stand, keeping knees together in short step length, close the door, and then walk away from the vehicle. Using these techniques should result in less frequent pain throughout the day.